Hi there, my name is Sonia Huber, and I'm the author of Cover Me, a health insurance memoir. And I wanted to first thank Marissa for taking the time to reach out to me and to send me a few questions about the book. Let's see, so I wanted to first talk a little bit about the process of writing the book. I was writing another book at the time, actually, a different book when I started writing Cover Me. I didn't realize I was writing a book. I was just having so much trouble with health insurance that I would, when I got really frustrated, I would open a Word document and just vent, and then would go about my day. And then over a couple of years, I noticed that I had a lot of material. And so I started to think about how I might tell this story in a way that wasn't depressing, because that's it's health insurance, so it's depressing sometimes. I put the stories together and added more and tried to ask the question about whether I could tell my life through the lens of a health insurance card. And around the time that the whole time I was working on it, there were huge debates about what would become the Affordable Care Act. And I had done a lot of research about health insurance, and in the end, I decided to not include the research element because so much of what I was reading in the newspapers was very dry, policy-oriented, lots of statistics, in a way that really made the whole topic very unapproachable. And I was really interested in just the human element of it. I do think that ideally, employers should be providing health insurance for their workers, including part-time workers. But I think the current system we have, the employer-based system, that does put a lot of pressure and financial responsibility on individual employers. And I think that the ideal system might be one that is not based on employers, but is more of a general, publicly funded solution along the lines of what we see with Medicaid or Medicare. I also do think that being without health insurance it's not something that anyone should have to go through. And I feel very strongly about that. And I feel that access to health care is a basic human right. And I feel that depriving people of access to health care, especially in the relative wealth that we live in, is just not a mark of a civilized society. I don't know if my book ended up brought more awareness to the issue, but I've talked to a number of people who have said that they appreciated it. If it ended up making people look at their own stories about health insurance, I think that would be something that would be most important to me. We have such a taboo in this society talking about money, and talking about the intersection of money, your job, and your body is so difficult for people. So mostly what I wanted to get out of sharing my own story was to help generate more of a discussion that it's actually okay to talk about some of these things. That's what's been most gratifying to me about the conversation that's come out of the book, is people talking about their own stories, which I feel is really important. So thank you very much for learning a little bit about the book, and thanks again to Marissa for asking me. All right, bye.